My primary area of cancer is ovarian cancer, and we're particularly looking at the two challenging aspects of dealing with that disease. One is early diagnosis or early detection, and the other is more effective treatment. We also try to investigate how these cancers begin, how normal ovary becomes ovarian cancer, because if we understand that process, we will understand better how we might be able to prevent it from starting in the first place. The funding provided by the Ottawa Regional Cancer Foundation has been used for seed funding or seed projects where we have a good idea we want to pursue it further. And it's great to give us that preliminary data to show that, oh, this is a really interesting idea and it looks like it's going to work. What we then do is apply to national funding agencies and ask them for 3 or 4 or 5 years of funding on a much larger scale. The aspect of my research that I'm most excited about right now, I can hardly sit in my chair because we're so excited by it. We've been studying very closely what happens at the very earliest stages of how normal ovaries become cancer. And by looking at those very earliest stages, what we have found is that there's a very unique cell population in the ovary, and it's very much like a stem cell. And what these cells seem to want to make themselves into is ovarian cancer. And this allows us then to identify the very start. This is where ovarian cancer begins, and so how do we get rid of those stem cells without harming anything else in the body? How do we get rid of those cells that we think are the origin of ovarian cancer? I think what we will see in 25 years is that cancer will no longer be a scary word. It is just one of those other diseases that we will find a way either to get rid of or at least to keep at bay, so keep under control in the way that we do now for diabetes.